Hi, my name is Dr. Sarwar Chaudhry. I'm a pulmonologist and sleep physician. And we are going to talk about rhinitis. Initially, we will talk about what rhinitis is, what symptoms it can cause, and how we diagnose, and at the end, we're going to talk about the treatment of rhinosinusitis. So, rhinosinusitis is the inflammation of the nose and sinuses. If it's just the nose, then we call it as rhinitis. When it's also in combination with sinus inflammation, it's called rhinosinusitis. It can be caused by different type of infections, which most commonly are viral in nature, but sometimes can be bacterial infection which lead to rhinosinusitis. In people who suffer from chronic infection or chronic symptoms related to the nose and sinuses, it could be due to allergic reactions. And in that case, we call it allergic rhinosinusitis. The symptoms of sinusitis are generally the discharge from the nose that may come from the front part, and it can be ranged from white to yellow to green in nature color, and some of that may be falling from the back of your nose into your throat, which we call postnasal drip. There could be congestion in the nose, difficulty breathing, or blocking of one of the nostrils at times. They could be also associated significant sinus congestion, pain, tenderness area in this area, and it could also be referring to the headache. Sometimes, and there is also associated ear problems causing pain or difficulty with hearing. If it's a chronic inflammatory rhinosinusitis, it can be associated with other symptoms or other problems like asthma. The diagnosis of rhinosinusitis is clinical. What it means is if someone has got typical symptoms of an infection in the last few days, then it's most likely infective in nature. And if the symptoms have been on and off for many weeks to months or years, then it's more likely allergic rhinosinusitis. On examination, we can see congestion of the nostrils. There could be polyps and there could be sinus tenderness. There could be secretions which we can see through the back of your throat, dropping from the back of your nose into the throat. And there could be fluid behind the eardrums on ear examination. There could be associated findings of asthma if someone has got allergic asthma associated with it. In terms of investigations, none is required in majority of the cases. If someone has got terrible symptoms or difficult to treat symptoms, then we may have to organize imaging of the sinuses with the CT scan. A blood test can also be helpful in some cases. In terms of management, depends on the type. If it's an infective rhinosinusitis, like in viral infection, we don't need to give any particular treatment. It's just supportive care. What it means is using some nasal saline washes or spray and taking some pain relief medication like paracetamol can be helpful. And those symptoms generally go away within 3 to 5 days on average. Sometimes the bacterial infection can start after viral infection, and it may take 5 to 7 days after the start of the viral infection, and those symptoms may be persistent for a few weeks. In case of allergic rhinitis, in that case, the symptoms would be there for many months and years. The treatment is primarily to block the inflammatory cascade in the nose and sinuses, for which we use nasal corticosteroid steroid sprays at various strength and for duration. So that will reduce the inflammation, reduce the mucus production, reduce the swelling, and can lead to significant improvement in the symptoms. We also need to screen for any associated asthma, and if that's the case, we need to exclude asthma, and we need to treat asthma to effectively control allergic rhinosinusitis. There are very special medications or immunotherapy that can be required in a small number of people who has got persistent symptoms. So if you suffer from any significant allergic rhinosinusitis symptoms, you can talk to your physician for proper assessment and management.